Now, what is your vestibular system, and more importantly, what has your vestibular system got to do with balance? I find a lot of patients that has been for therapy on their vestibular system or their balance problems, only to discover when they come to our practice that they actually have a low-grade binocular vision problem. What is the relationship between your vision and your vestibular system, especially when it comes to your vestibular ocular reflex? If you have a problem with the vestibular system, you very often find that you have dizziness problems, and you have instability, and you have balance problems. But it's not just a one-way street. It's not just the vestibular system that works on your eyeballs. There's also a feedback system as well. So if you have a binocular vision problem, you very often find that you have similar problems to if you just have a vestibular system. The vestibular system works in the dark. It doesn't need a visual input. And also, it is extremely quick. So there's a very, very quick reflex between your vestibular system and your vision. Actually, your vestibular system works quicker than your normal visual system. The good news is your vision can very often compensate. So as long as you got all three systems, or maybe even two systems working, you can still balance. In our practice, we very often also see patients that is elderly, and we do a binocular vision testing on every single patient. We call the dizziness handicap inventory form. This is available on the internet, and does looking up increase your problem? Because of your problem, do you feel frustrated? Because of your problem, do you restrict your travel or business or recreation? So this is a very simple but detailed form which you can actually download from the internet and have a look at, does this sound familiar to you? Now, if this sounds familiar to you, always make sure you see an optometrist that knows what's going on with binocular vision, because there is certainly a very close relationship between balance problems and binocular vision. And you might find that you've been doing vestibular therapy, but that's not the problem. The problem is actually binocular vision.